Hi, it's me, Dr. KT, and welcome to ODDDUCKSCIENCE. And y'all, I'm probably gonna ruffle some feathers, so we're gonna dig right in. Currently on the market, there's a drug that has been linked to brain tumors in women. This drug is called Depo-Provera. Many of you have heard of it. And what we know is about 1 to 2 million women use this birth control, aka the shot, a year. Now this shot works by stopping ovulation and it thickens the cervical mucus. And it's administered in the doctor's office about every 3 months. Now that we have all of that out of the way, let's talk about the facts that are really irritating me. And hopefully they irritate you and we can start some change. Now in 1974, 1978, and even in 1983, the FDA rejected Depo as a contraceptive. And the reason they said this is because they were siding with concerns about long-term safety and potentially causing cancer. Well, now there was this one company who went ahead with clinical trials, which we have talked about, and targeted low-income populations and women in developing countries. And their research just turned out to be flat out janky. And when I say that, it's because the researchers often fail to obtain proper informed consent. They had inadequate files and they failed to track serious adverse reactions, which means following up to repeat the science will be just about impossible, because good science means that you can repeat the same experiment and get the same results if everything is written out. Now this drug was going to be targeted to places where the minimal follow-up would be so small that you would only have to come in every 3 months. And of course that means it was targeting low-income women and minority women. Now instead of addressing the socioeconomic issues in our communities, they were like, here, give them this birth control. But that's a whole nother episode. I'm breathing and I'm irritated. Now, in 1992, the FDA went ahead and said Depo can go on the market against all that was said in the 70s and the 80s that I just spoke about. Now, they did have an additional clinical trial, and it was for 13 months. And the adverse reactions they found there were like headaches, abdominal pain, and weight gain, along with some irregular bleeding or breakthrough bleeding. Now, after the drug had been approved and was on the market, women started complaining. They started talking about they were experiencing chest pain, increases in cervical cancer, breast cancer, and having a hard time returning back to fertility. So for 12 years, there was no warning about how long you should be on this drug, and all of the side effects were minimized, like, oh, it's not that bad, it only happens to a small population. But in 2004, the FDA put a black box warning on the drug and recommended that this drug should not be used more than 2 years because it was causing a decrease in bone mineral density. This means that the bones were becoming weaker. Now this irritates me because, again, this drug was being prescribed to teenagers. Many of us had friends, girlfriends, cousins, family members, or knew someone in high school with us that was on a Depo shot. And it was marketed as this carefree birth control that you did not have to worry about. Come to find out, you had tons to worry about. Your teenage years are the most important and effective years to gain bone strength, yet this drug was working against that. And no one said anything. No one said anything because the clinical trials were only done for a year. Now here comes the horrendous part. In March of 2024, our research study saw an association between progesterone, which is the hormone that is in the Depo shot, and how it was linked to brain tumors. The brain tumors, of course, are benign, but who wants an intracranial meningocele brain tumor for using birth control? And this was found after only using it for 1 year. The study said if you used that shot, you had a 5.6 increased rate of developing these brain tumors. And because of that, Pfizer, who is the manufacturer of the drug, is now being sued. There are lawsuits all over targeted at Pfizer for knowing this information. So now there's a new black box about this tumor linkage. If you feel like this is you, please seek representation. And if you know a friend who is on Depo, please make sure they come off of it after 2 years. Now that we got all of the facts out of the way, I want to talk about my most favorite part of IDDUC, which is the 3 Ds. So the first D, let's go ahead and decode this science. What we know is the Depo shot is an injectable birth control that has been linked to brain tumors, which is why Pfizer is being sued right now, and it has also been known to decrease bone mineral density in women, and it's recommended that you don't use this longer than 2 years. Sound the alarm. You cannot use this longer than 2 years. Now D, diversify. How does this affect me and my community? I'm about to get in my bag in this one, and y'all are going to be upset. This may be an entire session by itself. For far too long, women have had the sole responsibility of handling family planning. From a very young age, we as young girls are taught, don't get pregnant, and that's about the extent of the conversation. And someone gives us birth control pills or the patch or signs us up for the shot and gives us all this paperwork that they expect a teenage brain to understand. No one talks about how harmful these methods can be and the way that they alter our entire biological system. All of those packets of information talk about things like blood clots. They talk about increased risk of cancer. But the only thing that we have told our daughters, our nieces, our cousins, the women in our lives is, it's okay, that doesn't really happen to that many people until it does happen. All of this to prevent pregnancy. Yet for men, they have one option for birth control, which does not require them to alter anything biologically. They put it on, they put on the condom, they take the condom off, that's it. I wonder why. I wonder why they only have one method. Now, there was a study that was talking about potentially having the male birth control pill, but many of the researchers cited that it would be too much harm to the male body. However, women have been dealing with this harm since the early 1970s. And it seems as if the world is okay with women, with us doing harm to our bodies, as long as we don't get pregnant. So when it does come to talking about birth control, we need husbands, dads, fathers, brothers, partners. Sit down and have conversation with your loved ones. Look at all the risks that women are taking to ensure that we don't get pregnant. These risks that women are taking are going to affect both of you all in a relationship. Is it worth it? Now my last D, dazzle. How can I put my dazzle on? How can I put my dazzle on all of this? You have to be educated about all of your medication, not just birth control, because these medications are altering our bodies. We have to be able to make an informed decision, and that informed decision requires us to sit down, talk to one another, and have some real conversations. I know some of us are not comfortable talking about sex, but we need to talk about the risks that are associated with it. We often kind of laugh it off and play it off that it's not that serious decision, but there are women who are developing brain tumors because they were told, don't get pregnant and nothing else. Well, I hope you learned something today. And as always, science is accessible for everyone. Until next time, I'm going to encourage you. This is why we need more female doctors. This is why we need more female PAs. This is why we need more nurse practitioners. This is why we need more female scientists, because we need people that are going to speak for us and speak for the protection of our bodies. And women, I hope a certain demographic of you all will stop voting against the rest of us. Until next time, have a glorious day.